Hi, my name is Evan. I run the Den Mother Canine Instagram account. I'm going to start uploading videos to this YouTube channel using this North American Rescue Canine First Aid Simulation Mannequin to demonstrate some of the canine first aid things we talk about that maybe aren't as easy to understand or visualize through infographics, still photos, and a lot of paragraphs. So this first video today is going to cover bleeding of the canine extremities. A lot of bleeding from canine extremities isn't going to result in any kind of geyser or arterial spray, but if it does, the two bottles here in the front of the dog I like to call Marco represents the average amount of blood in a 70-pound working canine, going off the average weight of working canines being 70-ish pounds. So if they are having massive hemorrhaging, there's only, this is a 2-liter bottle and a 1-liter bottle. That's all that's in there that they have to lose. First thing that we'll go over is any kind of massive hemorrhage where it might be more appropriate to place a tourniquet than trying to do a pressure dressing or pack the wound. So here's a rear leg, which could have a major arterial bleed and having an open compound fracture, whether that's a partial or full traumatic amputation. When we start the bleeding, of that, you can see it's bleeding. So if you have this kind of arterial spray, you immediately want to try to grab the leg. And so you can see that me grabbing this leg, which is a lot more rigid because it's mechanical, works to stop the bleeding, and it works the same way in a not robotic canine. Then you can take an ACE wrap. I'm going to demonstrate an ACE wrap first. Place it high and tight above the injury, trying not to squirt more blood everywhere. And then wrench it around the leg super tight. So this mannequin is or would still be bleeding if this tourniquet wasn't working. With any kind of tourniquet or bandage to tourniquet effect, if you can fit something underneath it, then it's not working. You don't necessarily have to use the whole roll. You can always place your hand underneath a loop. Make a couple. And then tuck it underneath. It might even be better to tuck it on the bottom side to put more direct pressure on where that femoral artery could be bleeding. And this is one of the things you'd want to check each time you move the patient in case it shifted and is no longer working. You may even want to use some tape or something to secure it in place to make sure that that tuck doesn't come undone at some point. So now I'll demonstrate the same thing pretty much, but with the SWAT-T tourniquet. And this is basically just like a big band you could do like PT exercises with. It has instructions on the front, making it dummy proof. So the idea is that you stretch the wrap until those rectangles become squares. Same thing with the ACE wrap. The SWAT-T just kind of does it better and faster without having to put as much effort into stretching the bandage out and getting tension on it. So again, if you have any kind of massive arterial spray, you want to grab the leg and stop the bleeding. It's always a lot easier to treat a canine casualty with more than just yourself. But at this point, it would probably be better to have someone take the SWAT tourniquet and place it above your hand. If you're by yourself, you may end up letting some more blood escape the body while you put the bandage on, but at least you've stopped it while you're getting your bandage or the SWAT-T ready. So you have the blood stopped by squeezing. Take the ACE wrap, not ACE wrap, SWAT-T, and stretch it around the leg You can kind of see, you know, those rectangles turning squares, and keep wrapping it until the bleeding stops. The more you wrap this, or an ace wrap, the more secure it's going to be, and the less it may shift while you're moving them. Same thing when you want to get into the end of the roll. You place your hand underneath it, underneath that loop. Yep. And tuck it underneath. So you could probably hear the pump still going. It's really not that hard to stop the bleeding in this canine mannequin. And it is more difficult to stop it in him than an actual 70-pound working canine. After covering, when it might be better to use a SWAT-T or ace bandage to tourniquet effect on a canine extremity that's bleeding profusely or is a traumatic full or partial amputation. As well as with that back leg injury, it has an open fracture. Trying to pack that wound or put a pressure dressing over the exposed bone or a stump, especially with a dog that doesn't have any pain medication or sedation, can be very painful and very difficult to accomplish, as opposed to just wrapping a tourniquet above the wound and tightly. I don't think I covered it previously, but obviously, you know, with any not mechanical robot working dog, you'd want to put a muzzle on them almost always before doing anything like this, because there is always the potential that they'll react and come up swinging at you. There are instances, we cover another video with a critically injured dog that you wouldn't want to put a muzzle on them, especially if they're having difficulty breathing. Also, another disclaimer, all of this is just for informational purposes. You know, you definitely need to hopefully seek out more training if this is something you feel like you need as a working canine handler. But hopefully this gives you, explains more better the stuff you may already have in your first aid kit and how to use it. This kind of canine extremity injury, maybe you could consider it a lot more common, something you could see from doing a track to an intentional injury from a bad guy. A lot of these injuries, you're still going to want to grab the leg above it because you're always trying to stop more blood from leaving the body, but it may not be squirting or having a huge amount of blood gush out of it. You're still going to want to bandage it and apply direct pressure. One of the easiest ways to do that is taking either your Olays dressing, or if you have an emergency trauma dressing, and covering the wound that way. Grab the leg, treat the injury. Place the bandage over it, applying pressure. Camera. And then tightly wrap that around the injury. Keep it covered and to stop the bleeding. This bandage has been reused a bunch. They normally have a plastic clip on the end that you can use to secure it on itself, as well as you can also tuck it like any of the other dressings. One thing, if the wound continues to bleed, it's called strike through. You don't necessarily take bandaging material off. If you have strike through, put more bandaging material, like another dressing on top of it, and apply more pressure. The other things you could use to bandage this kind of injury to the leg, whether it's up high, down low, even on the foot, is just using your roll gauze or compressed gauze and an ace wrap. You can make a power ball, even though you're not going to pack this like a pocket wound. But you can at least make some padding over the injury itself. Apply pressure.
This especially is a good way to do it if the laceration injury itself is longer or wider than the pad of the emergency trauma dressing. Once you have the gauze wrapped around, you always want to try to keep pressure over the injury. And then you're applying more tension, making your own pressure dressing, with this being a compressible injury. If you can control bleeding without causing a tourniquet effect to the leg, or like their bottom leg here, if this was wrapped really tightly, will start swelling. That's always ideal. But with a pretty significant injury, you're going to want to treat it and transport them to see a doctor in a hospital. So if it's drawn too tight, then you have a 15 to 30 minute drive to the doctor. It's really not a big deal. You can watch me keep wrapping this, but you're going to end it the same way as every other high and tight tourniquet or pressure dressing bandage. You can tuck it. They do have Velcro on the end, but you want to make sure that this doesn't move or come loose or undone every time you move them or they move. A lot of the times, if you just have it secured with the Velcro, it's going to fail and come flying off.
So dealing just with canine extremities, kind of the principles of bandaging and being a compressible injury are the same, whether it's the front leg, back leg, or their tail. Whether an injury, appears like this, or could appear like that on the inside of the leg, you would bandage it the same way. If they had the arterial spray from the back leg with the open fracture, or there's this additional rear leg that simulates an amputation, it's going to be a lot easier just to SWAT tourniquet it or put an ice wrap high and tight around it to stop the bleeding. So one other bandage that I'll demonstrate is because I kind of get asked about foot injuries a lot. They're super common. Outside of emergencies, you're probably going to have something happen to your working dog's feet. This dog actually does have a simulated paw injury. So I'm going to show you how I'd bandage that to get them back to where you need to, or even if you have to keep it covered to let it heal for a while. I use ice wrap instead of vet wrap. I'd say something like this vet wrap works well for. I don't like carrying vet wrap in a first aid kit, or Co-Band or Co-Flex. Same kind of thing, because it often melts together and it's really hard to get the roll started. But anyway, paw injury, same kind of thing. You want to use some gauze to cover and pad the area. This is Z-fold gauze, so it's not as easy to wrap around. So one thing when bandaging the paw is you want to leave a lot of padding, because you want to compress it, but you don't want to cut off circulation necessarily. And keeping these last two kind of pads or toes exposed is a good idea if they're not injured, because if this is too tight, then the pads kind of spread apart, and then you can loosen up the bandage. This isn't a very good job. If you are bandaging a foot for something like this, you want to try to keep the gauze flat and without wrinkles, so it doesn't make pressure spots, hot spots, whatever those things are. So yeah, don't do it better than this. Once you have the gauze there, taking vet wrap, ace wrap, you want to leave gauze exposed because you're not trying to cut off circulation, but the gauze lets you
compress it down to protect their feet. So you also want to leave some of that non-compress or that compressible gauze material visible top and bottom. Same kind of thing if you had a laceration that you didn't need to apply a tremendous amount of pressure to, you leave gauze top and bottom and compress it, control the bleeding and cover the wound. The one thing about ACE wrap versus co-band is you can't just cut it and put it down. So if you have ACE wrap and you're doing this bandage regularly, vet wrap's definitely the way to go. One last thing about bandaging canine extremities. I think someone had asked, if you are bandaging up higher on the leg and you don't want it to slip down, you can use over the back or over the shoulder to kind of anchor that bandage. Like let's say there was an injury here, we were bandaging. We don't, you can see this is the reason why a lot of windlass like cat and SWAT-Ts don't work so well, especially on dogs' rear legs. It's the conformity of the leg lends everything to kind of slide down it. So after a couple wraps over that, securing that in place, you can wrap over the back and underneath. And then try to wrap around again, then back up over. And it is tough because everything wants to slide down the leg. So that's pretty much it for canine extremity bandaging. This is really just a quick video trying to demonstrate some of the best ways common first aid field supplies are used on a dog, as well as, a lot of people ask about canine tourniquets and, using human ones or if they're necessary. Definitely don't go off of just some guy on the internet demonstrating stuff. There's a lot of good trainers, especially with the development of these mannequins. You can go, find training and practice this stuff to develop muscle memory.